Welcome to Maternal IQ, presented by Motherocity Health, a news show that provides less noise and more facts on maternal health. I'm your host, Lydia Simmons, and today we are joined by co-host Nicole Danos. Today we are exploring this week's highlights, but before we get started, I want to tell you a little bit about our co-host. Welcome, Nicole.
Hi, Lydia. Thank you for having me today.
Oh, thanks for being here. And thanks for saving the day for all of you guys who are joining from LinkedIn. We had some technical difficulties, so we're over on Zoom now. A little bit about Nicole. Nicole is an associate professor of biology at the University of San Diego. She dons a PhD in biology from the Harvard University. And she also suffered postpartum depression and mobility constraints after the births of her two children. She's a researcher in muscle physiology during pregnancy and lactation. And as of recent, she has the backing and support of the National Science Foundation, where they are using their research expertise to fill in some of the grave gaps in our understandings of what the maternal body goes through during pregnancy and lactation. Specifically, they focus on the muscles and the tendons of the legs that make movement and exercise possible. So, welcome again, Nicole. I'm really glad to have you here. I think that you have incredible insight and a pulse on what's happening in maternal health. And it's just great to have you here to share your expertise and resources with us. So, I can't say thanks enough.
My pleasure. And again, I love what you're doing with this show. Less noise, more facts, please.
Yeah. I have to tell you, like I've shared with everyone else, we are noticing that there's a lot of sound bites that are socially driven, and a lot of those things are noisy. Some of them are factual, and some of them are just, a place to emotionally dump some of the things that we do experience as women in the industry. We wanted to kind of reduce some of that and bring everyone over here to gain insight on some of the things we never hear mentioned, but that are still going on in maternal health care. So here we are, Maternal IQ, and we are always glad to be a beacon of light for anything maternal health related. Today, we are exploring this week's highlight in maternal health, as well as getting the firsthand briefing of the postpartum body scorecard with you and what we all should be doing, what we all should be educating on after childbirth when it comes to mobility. But first, I think we should talk about what's going on around the world in maternal health care. You ready for that?
Let's do it.
All right. So I have to tell you the big picture on this. The country's maternal health crisis and loss of abortion rights in many states has really spurred rapid uptake of new extended coverage options. Even in conservative state houses that have long resisted much of the broader Medicaid expansions under the Affordable Care Act, they are now adapting to the change. While nearly every state now provides Medicaid coverage for a full year after giving birth, cost concerns and political opposition in some states have prevented the policy from being fully adopted nationwide. Can you guess? Well, I'll tell you this. There's 4 states that are still holding out on extending coverage to postpartum families. Can you guess? I'll give you a better. Let me reduce this. I'll give you 3 shots to guess who the only 4 are. What are your picks? What do you think?
Oh my
Oh,
God.
wait, it's not Texas.
Okay.
It's not
Thank you,
Texas.
Texas. Okay. I would say Mississippi,
Okay.
Utah, Florida, and Alabama.
Woo.
How did
Nicole,
you do?
0 for 4. 0 for 4. Can you believe that?
That makes me
You ready
happy.
for this? The 4 states that are still holding out are Arkansas, Idaho, Iowa, and Wisconsin. Isn't that ridiculous?
Wow. Okay.
Ridiculous. I mean, Arkansas as a state has recently pushed through new funding for their maternity deserts, their maternal care deserts, right? They also, we just reported on this a few weeks ago. Arkansas has also given more money into what they say are postpartum health care benefits, right? There's not a lot of understanding about that just yet. But for them as a state to not have adopted this yet is a little bit confusing, being that they have highlighted that their doula care programs need more money, that their postpartum care programs need more money, but they're still holding out on signing this expansion into law there. Idaho, Iowa, I would say Idaho, I'm a little shocked by that. Iowa, I wouldn't say so, but Wisconsin, I would think that Wisconsin, being one of the states that has the highest rates for maternal care deserts, would be on top of this already. What do you think?
And it's just, it's hard to hear that. It's hard to hear that something so easy is so hard to implement. And especially that there's so much resistance. I don't understand that resistance. I mean, the data is very clear. When mothers thrive, families thrive, economies thrive. So I don't understand that. And that's really all I have to say. The politics of it eludes me, because that's where the
Yeah.
only part where that's the only thing I can imagine holding anything back. There's some political spin that I just don't understand.
Yeah, I don't understand that either. And I think that the important um, spotlight here is that some of our toughest legislative states who have rejected other things that may be other bills being passed that may be beneficial to women, especially in healthcare or women across the board, have signed off on this. And
Okay, that's
so
good news. I'll take that.
that is
That's
good
really
news.
great news.
Yeah, yeah, there is progress there. That there is progress. But I think that we will see those four states come into the fold in the next few weeks to months as their legislation resumes sessions. So let's wait and see. Let's
That sounds
move
good.
along. The USA Today news outlet has released a report stating that a simple aspirin could prevent a leading cause of maternal mortality is often overlooked until it's too late. What they're talking about is preeclampsia. And we both know preeclampsia is a serious form of high blood pressure during pregnancy, but also postpartum. And it often goes undetected by doctors until it causes significant organ damage. And by this point, preterm labor becomes a risk, and postpartum death could become a risk. And affecting both mothers and babies, this has become a really high pinpoint conversation that is being discussed. Factually, women of color, particularly Black and Native women, face a higher risk due to existing health disparities, comorbidities that may be biological on those tracks there. And this week, the USA Today reports that an initiative was launched that aims to address this issue by detecting and treating preeclampsia earlier. Now, there aren't major reports on this, but it's being said that a treatment as simple as prescribing an aspirin to women who have given birth or women who are to give birth that are showing detected signs of preeclampsia risk and who also may have been already diagnosed with preeclampsia may prevent any further exacerbation of the condition and bring more babies to full term. So we're excited about that. Just a little fact here in 2021, the Centers for Disease Control, the CDC, reported 1,205 maternal deaths. So that's an increase from 2020 of 861 deaths. So we have seen an increase there. And a lot of those have been linked to preeclampsia. Did you experience this in either of your pregnancies?
I did not experience preeclampsia. Um, and I will say that I also did not experience the ignoring that often comes with uh, women reporting that they're not feeling like themselves. So one of the tricky parts with preeclampsia is that this high pressure is not consistent, that
Mhm.
it spikes very fast and very
Yeah.
high. And so you might be going into the doctor because you don't feel right and you think something is worth um, investigating. They take your
Mhm.
blood pressure. At that moment, it is fine. They send you back home,
Yeah.
right? And
Yeah.
there's lots and lots of evidence that women of color get dismissed a lot more frequently than white women.
Yeah. It's a fact. It's a fact. And in fact, Black women experience a mortality rate more than double that of white women, whereas preeclampsia is concerned. But that also trends across many other mortality reasons and comorbidities. Furthermore, the CDC identified that over 80% of pregnancy related deaths were preventable. It's always funny when those types of things are written because yeah, we know that. That's why we're all here, right? It's kind of, just for me, it's kind of like stating the obvious, right? But okay. Additionally, one third of pregnant individuals who died during delivery had hypertensive disorders, including preeclampsia, which accounts for up to 8% of all maternal deaths in the US, according to the March of Dimes, that is. So, noticeably, preeclampsia can occur during pregnancy and postpartum. And I think that we all are aware of preeclampsia during pregnancy, but many of us do not know that preeclampsia can also occur during postpartum. Um, just a few months ago, Tori Bowie, do you remember that name? Tori Bowie, the Olympian who
Yes.
died of preeclampsia related symptoms. She is a decorated Olympiad who ran in track and field sports, and she's as healthy as could be. I mean, you think about the rigorous trainings and testings that those athletes have to endure prior to even being compatible or being released to run in those sports. And she died, and preeclampsia was stated as her cause of death. This, for me, um, highlights that we don't know enough about preeclampsia during postpartum. And a lot of the studies and funding have been pushed to preeclampsia during pregnancy, which are still high rated numbers and are not being, the medical care for that is not being observed as necessary. So I think we need to kind of watch this and see what happens with this study of an aspirin being the reason why we are going to reduce some of those numbers or not. Let's see what happens. We'll report back on that.
Yeah.
One more story, Nicole.
Let's do it. What's up?
Okay. The UK is reporting concerning rise in maternal death rates, signaling underlying issues within its healthcare system and maternity care. Despite the pandemic's impact, which undoubtedly plays a role, persistent disparities and systemic shortcomings are evident. Vaccine hesitancy among pregnant individuals, inequitable care for ethnic minorities and disadvantaged groups, and inadequate mental health services further exacerbate the problem. Urgent action is needed to address these challenges and ensure all mothers receive equitable individual care before, during, and after pregnancy. That is a quote that our UK Minister of Health has released concerning their rising maternal death rates.
Hmm.
This is something that I have a lot of thoughts about. Let's hear yours first. Does that strike any chords with you? Have you seen any rise on your end of study in the maternal mortality numbers in your population?
You know, I'm always very skeptical of numbers like these because I know that it's all about how you were asking your questions and how
Yeah.
you were collecting your data in the previous years.
So true.
So,
So true. Um, I will share with you a little bit on this. So, COVID being one of the major things that has affected medical and healthcare systems over the past few years has been a way that we've been seeing numbers were skewed during that time, especially for maternal mortality rates. COVID has been marked consistently as a cause of death for many women who are possibly dying of COVID or COVID related symptoms, but that also doesn't capture what their comorbidity was that led to possibly death as well. And so some of those numbers, I don't know that we'll ever actually recapture on that. Now that COVID is not a major factor where health is concerned, or it's not as heavy as a factor as it was back, let's say 2020, 2021, places like the UK are having to now actually acknowledge that they have a problem, like the rest of the world has a problem with this. And we've been screaming it for years. And so for this report to be brought out now, it raises the question and the concern of, if now you have a rise in maternal mortality rates, what are those causes of death? Because that's not included in the statement that was released. There is no breakdown of where they're trending there. And I would be very, very eager to see what those numbers are. We do know that we aren't seeing COVID listed as a cause of death as of recent, but we do know that COVID is alive in places, and we have even states within the US that are reporting rising COVID numbers, right? So I'm very eager to see what happens there. I think with you being in research, you can also chime in here on what you see as far as research trends and how that year over year number impacts what the real reasons are. Do you think if the UK has missed accurately reporting during 2020 and 2021 of causes of deaths where maternal health is concerned, do you think we can actually get accurate readings in 2024 on that?
That's a good question. And again, it depends on who's asking the question and what their interests are, right?
Mhm.
The data is somewhere out there, I believe. And if somebody's really motivated and wants to know what of those maternal deaths that we attributed to COVID, what other comorbidities were happening, I'm sure that can be done.
Yeah.
But at this high level of the Ministry of Health, if their data collection was inadequate, we're going to miss that. But I will say the silver lining here is that they're paying attention all of a sudden to
Yes.
maternal mortality.
Yeah. We love that. We love that. I think that it's easy for us to kind of get stuck into the why didn't you do it right the first time? But I think that you're right. In the places that we lie today, whereas health concerns are rampant and numbers are increasing in value and size every day for maternal health care, we do have to actually acknowledge the wins. I think that understanding where things went wrong in the past is also important so that we're not repeating those things. What I see a lot in reporting on my end here is a lot of aggregated data.
Yes.
And, I think that we've become I think we've become a competent group of aggregated data collectors. We're really excited about the data a lot, but we're not so excited to de-aggregate that data and put things into action. And that is where I'm starting to see countries like Sweden that are improving maternal health care standards. And I mean, they're getting it right, all the way right from the time that mom and that family enters the maternity ward a year to 2 years later, the way that they are supporting families. And I think if we're looking at a model, and if the UK really wants a great model of where they should be on the map of care and the rollout of care for moms who are in gestation and are in postpartum, they should look at the way that Sweden has rolled their plan out and taken particular care and concern for exactly what those things mean to both sides of interested parties, both medical and both home. And I think we could even adapt to that, Nicole.
Yeah.
I would employ anyone who's listening today to take a deep dive into what Sweden has going on. That's for doula care, midwife care, your traditional medical system. Go and look at what Sweden is doing. It's admirable and it's right. And I think that they have set the standard here. UK, if you're listening, check into Sweden. They've got some answers for you. Let's jump over. Nicole, I think that we have wrapped our trending topics for today. Let's jump over into a little bit about you. Let's tell everybody who you are, what you're doing, and how your experiences has led to you moving into a research position to understand the significance of muscle physiology during pregnancy, during lactation, and how we can benefit from that. Can you share your personal journey with your postpartum depression and mobility constraints after the birth of your children?
Yeah, I'd be happy to, because now I'm past it. At the time, it was a pretty big challenge, but I'm going to step back even a minute before I even became pregnant, where I was trained to be a scientist. And I was trained to be a scientist in in a field called biomechanics, where we're interested in how movement happens in the world, the biological world. And we were doing things like trying to mimic what fish can do and try to build underwater robots, and trying to understand how to design spring actuated um, exoskeletons for people with mobility issues. So that was my career trajectory. And then I became pregnant, and at the time, I was studying what happens during advanced aging to our muscles and tendon skeletons. Right? And I, what we were finding during advanced aging is that everything becomes a lot stiffer, which everybody knew kind of by experience, but we were actually measuring it and demonstrating it scientifically, and also understanding what the downstream effects are of that. What does it
Yeah.
mean for our movement, our overall health, how we use energy as people that move? So I go to the doctor as a pregnant scientist, and they tell me that, listen, you are now pregnant, and all your connective tissue, your ligaments, your tendons are going to be extra stretchy because of the pregnancy. So please take your exercise very, very carefully. Don't overdo anything. And I said, okay, well, that's kind of interesting. As a nerd, I went out to look for those papers and the scientific resources that documented this. And I couldn't find any. I couldn't find any. And I thought it was just that I wasn't looking hard enough. Okay. And so around that time, also, people like Alice and Felix were returning to their sport after having their baby, after having a major fallout with their sponsor, Nike, over the fact that she had become pregnant while working for Nike as an athlete, and they wanted to cut back her compensation. Um, and as a scientist, again, who had dived into the literature to see what happens during pregnancy, um, I couldn't understand why Nike was making this claim that her performance would be decreased. There was no scientific evidence for that. And then, of course, she comes back and she breaks all her previous records and wins several more Olympic medals,
Sure did.
demonstrating that not only is pregnancy and lactation afterwards not an doesn't impede athletic performance, that maybe it even makes it better. Okay, so that was my journey as a scientist. But unfortunately, after I had my baby, and there were lots of complications during the birth of my baby, um, I I suffered from postpartum depression. And at the time, I did not know to verbalize it as such. I was regularly asked by my gynecologist if I was having thoughts of hurting myself and my baby. And my internal response at the time was like, even if I did have those, which I actually did, I'm not going to tell you. I'm not going to tell you. I don't know. I don't know what you will do for me. Um, I don't, the system, the healthcare system is very opaque to me. And I also felt like we lived in a country where women's bodies are very criminalized and very easily and absolutely, again, opaquely criminalized. So I wasn't about to put myself in a situation where instead of being helped, I could turn into a villain. So I powered through it with the help of my husband. I tried to maintain a healthy lifestyle, um, come out of it. And I will tell you, it didn't look like depression. Like it's not like I was wanted to sleep all the time. I had very intrusive thoughts about my baby, and I was very, very anxious all the time. Very anxious. The fear that something major was about to happen, and I was not prepared for it. So I'm very grateful that we got through that just with the support network that we had. So during my second pregnancy, I knew to expect that, and I knew to ask for help before I even needed it, because then I felt like I was more in control of advocating for myself. Um, so that's my experience with postpartum depression.
Yeah. It echoes so um consistent with so many times that we've heard this, the many times that we've heard very similar things. I think one of the only things that I heard about the way that my body would transform was the word relactin kept being thrown at me. Oh, you got this hormone relactin and it's going to start excreting into your muscles and it just gets your joints and, everything kind of loose and wobbly so that you can get this baby out. And that's how the baby comes out. And I think that in the world of OBGYN, there is a laziness that has started to happen, almost like a parroting, right? Where you just hear someone say it and then you say it, and then whoever you're mentoring now says it. And nobody really puts a lot of thought into, okay, well, if it's that, then what else comes along with that? And what portions of these can we share with our patients to
Yes.
familiarize ourselves? I hate that you had to find out on your own. I hate that any of us do. And I really would love to know, um, how long do you think it took to reach a full postpartum recovery? Have
So
you reached it? So many people
postpartum,
say they
you mean
haven't,
with respect to my depression?
with respect.
With respect to the depression, there was a big jump when I stopped breastfeeding, where things improved. And then again, I mean, I'm still on antidepressants, to be honest, because I'm too scared to get off them.
Yeah, I totally relate. So for me, this is something that we deal with here in house. I have extended anxiety, but I lived with postpartum depression for about 4 years, undetected and untreated. And now I have anxiety, and I'm grateful that I know what my triggers are, which is just being overstimulated. I have realized that if the TV is on and my husband is talking, and I'm trying to hear the last bit of a lecture somewhere here, and, you know, that's too much. I need it to come down into a singular stream of sound so that I can relax that anxiety. And now that I know that those are triggers for me, I'm able to manage that a little bit. It doesn't stop it from happening. It's just so that now when it does happen, I'm like, wait, 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 too loud. Let me remove myself. I'm often seen both in office and home with just a pair of headphones on. Just little ones, because when I can't control the noise, because who can control a 4 and a 5-year-old, really? Um, because I can't control the noise, I then will go within to get that quiet, and I will just put on something that I want to hear, and I'll just kind of focus there. But that is my self-medication. And I hear all too often that so many of our partners in maternal health, partners in motherhood and parenthood, are still trying to navigate the effects of how their bodies changed mentally as a result of this. And here you are saying, listen, this is something that still ails me. But like the announcement we just read, we've discovered that these things can completely be prevented, right?
Yes.
What would you say prevention would look like for a person today if you could say, here is the rubric for how to navigate what's going to change and happen in your body that may offset some of these things that I now experience postpartum and post childbirth?
I will say that exercise is one of the greatest stabilizers of all kinds of fluctuations. So the stronger that we maintain our body during any kind of transition, the easier the recovery will be. And this is where my own research came into play. And I'm really happy to be able to fill in some of these blanks that I was finding in the scientific literature. Because again, there are recommendations for what types of exercise people should be doing during pregnancy and when they return from their birth, when that should be happening. Um, but very few of those are actually based on real research. A lot of them are based on erring on the side of being like extra cautious. Yeah. And so the problem with being extra cautious means that we underprescribe exercise, when in fact, exercise is one of the best ways to maintain mental and physical health. It prevents so many other side effects of pregnancy that are not mental, and definitely postpartum, right? So, and here's one of the things that I found during during my research, is that pregnancy has an important effect on muscles, but not as big an effect as lactation, breastfeeding.
Wow.
Yes. So
Wow.
if a mother is
Oh,
breastfeeding,
lean into that.
right. And here's the thing. During breastfeeding, all of the individuals that we examined lost about 25% of their leg body mass, muscle mass. 25% of your muscle mass is gone if you're lactating. And that is very, very significant because guess what? Muscle mass is actually an indicator of mental health and mental acuity long term.
Wow.
So if we're not maintaining our muscle mass, that means overall our health is declining. Now, not only are we losing muscle mass during that stage, it's also changing. So you may be familiar with the fact that there are some muscle types that are better suited for fast exercise versus endurance. And what happens when we lose muscle mass is basically a condition called sarcopenia. We're losing muscle mass, and it happens during different kinds of stages and diseases as well, is that our muscle fibers change from this high intensity type 1 to type 2 fibers. And that means that, and those fibers have a different susceptibility to insulin at this point. So then our exposure and our preconditioning to diabetes also goes up when our muscle mass goes down and we get these changes that are due to the lack of exercise. So there is no reason why we should not be exercising. And that exercise is incredibly important in the postpartum period.
You've said so much. My brain is exploding because it's so good. Um, a change in muscle fiber. Would you say that also makes you susceptible to more injury if that fiber's changing?
Mm-mm. It's not the
Okay.
muscle fiber, but it's the laxity of your tendons. So we examine the Achilles tendon, which is the big tendon at the between the foot and the calf muscle,
Mhm.
and that becomes more flexible in the majority of the pregnant individuals we examined, but definitely again in all the individuals that were breastfeeding.
Wow. As you're saying that, I'm going through my checklist of things that have happened to me since breastfeeding and how my body changed, injuries that I sustained for a little bit of nothing. I mean, at one point, I could just brush against the wall and I would be aching for multiple days. And do you remember a few months ago, I texted you like super late and I was like, I've got to tell you this. My body doesn't even lay the same way when I
Yes.
sleep. Like
Yes.
I can't, my mind remembers how comfortable I used to be. And I am pre-pregnancy weight. Those things have, reverted back to similar times. So I don't know why I can't get comfortable in the way that I remember being comfortable sleeping. And what you're saying to me is supplementing these ideas that I've had, but no basis behind them because the evidence, the study, the research hasn't been done. Thank God for you because you're doing it. You're doing it. But you're saying to me what I think a lot of women are probably wondering and have wondered in the past. Why is my body not responding to the things that I did pre-baby and that I did well and without effort, even in instances where that particular mother may not be at an age where her body should be showing signs of aging and decline. And you're answering that. Lactation could be the complete culprit for that.
It could be some kind of hormonal effect from that. Um,
Mhm.
Again, it hasn't been studied, so we don't know. Do individuals that don't lactate not have those problems? Um, Anecdotally, it doesn't seem like it. How
Yeah.
long do they persist? Do these effects persist? But I want to make 2 points. One is that one of the things that we often forget and we're not taught enough is that our body is constantly remodeling, especially our
Mhm.
muscles and our connective tissues. And so, what we're doing during those remodeling phases, when the body's also changing because we changed our whole backbone curvature and hip structure to accommodate this baby. Then we pushed it through the birthing canal, or we had a C-section where somebody cut through a bunch of connective tissues, moved them out of the way to extract the baby. When that remodeling happens afterwards to bring everything back to pre-baby situation, if we're not putting on the right kinds of stresses on our body, things will remodel in a way that will always be tense or uncomfortable. And that's where my own mobility issues came afterwards. It turns out that I had a very, very stiff, um, what do you call it? Scar from my C-sections. And that connective tissue was then constraining my hip mobility, which was constraining what was attached to the hip, which is my whole leg, and was causing me immense pain when I was walking.
Goodness.
And again, if somebody had told me that after surgery, for example, you need to massage the scar to release the tension around the formation of the scar, and you need to stretch this way and that way, then I would have done it. The only healthcare professional that picked up on that was a pelvic floor physical therapist,
Yeah.
um, who was able to pick up on that.
Wow. So much there to unpack. Let me just start by saying that for the OBGYNs who are listening, and for those who are looking to introduce new tracks of recommendation and treatment for your patients who are going to experience an inevitable childbirth, who have experienced that and are complaining about things during their postpartum, one of the first things you can do is write them a referral to a physical therapist so that someone can start really looking at that. But not just any physical therapist, not just any chiropractor, a Webster certified physical therapist or chiropractor who studies the health of the pelvis. Because as we're learning today, those problems that Nicole experienced could have been avoided if someone would have simply told her about mobilizing her C-section scar, which is not a conversation that we hear for the medical personnel in our medical centers and hospitals. This needs to be added to discharge instructions. I could say it nicer, but then you may miss the point. You're missing the mark here by discharging any families from your wards without explaining to them the proper care of their C-section scar that goes beyond not submerging in a bathtub. Okay.
Thank you.
So,
And yes, again, pelvic floor rehab is
yeah,
not just about vaginal health. Pelvic floor is everything below the belly button uh, that holds the body up. There's no way to say it. And again, other countries have this standard process. You
yeah,
leave the maternity ward, you're assigned a pelvic floor therapist.
yes, yes. Would you say, would you say that possible pain that you were enduring increased mental health decline for you?
Yes.
Yeah.
Because the pain itself just made me feel horrible, but then it
Mm-hmm.
also constrained the amount of exercise I could do.
Mm-hmm. Hand
And
in hand.
so not exercising regularly was, I didn't have that release for my mental health.
Yeah. My goodness.
Yeah.
I am reliving alongside your breakdown of these things, and I can even pinpoint things that could have been done better. I can also, from just your time with us today, write um, an entire description and directive just off of it. And I think that anyone who's listening here, if your mind is not buzzing with, oh my goodness, we're totally missing the mark, we can include this, we should be doing more of this, then you need to run it back so that you can hear again what's being said here. Dr. Danos is telling us that these things contributed to these things. It's a very, very high level experiential data that's coupled with her experience in researching exactly how the muscles and tendons are responding for mothers who are lactating and postpartum. This information needs to get out. So I hope that everyone that's visiting today is able to share this amongst their network of people as well. On the mental health side, I will share with you and the audience. It's something that I'm very vocal about. I experienced postpartum mental health decline for quite some time. I remember going into my OBGYN and saying, why am I feeling this way? You know, this is what's happening to me. And we're beyond that period that you told me about a discharge that you call the blues. What's happening to me that I cannot overcome this state of mind that I'm in, and I'm fighting and clawing at it, and my body is saying, hey, you can't do anything about it. And everything that I attempt here is just kind of falling on my own body's deaf ears. I remember my doctor kind of giving me the nudge of, this is a rite of passage. You should be grateful that you're alive. You know, you've had a baby, your body's done a wonderful thing. It took, 40 weeks to make a baby. It could possibly take 40 weeks to undo, making a baby. And that's kind of where things were left. And along with that came a referral into general practice. Go take this into your primary care's office and talk to them about this. And maybe they can, work with you from there. But what I felt and what I know today is that these issues that you and I both are sharing here are things that stem from the care of the uterus. And those things should always be housed in the OBGYN clinic. And if there are any medical directors here, anyone who's over the organization of how your medical offices and practices are run, I think that the takeaway that I would give you is that the experiential data weighs heavier than the course of biology physiology, chemistry, or any other sciences that you studied, those theoretical things do not match up to what your patients are telling them. If there is an issue that's happening within a certain amount of time beyond having a baby, those things should still be housed under the care and provisions of the OBGYN clinic. And I think we are starting to see across the country here that those things are starting to be recognized. And where there is funding, a lot of those offices are bringing a little bit more concern to that, but we still have some growth to do. So conversations like this are definitely necessary. What would you tell the audience? What would you advise to the mom who is going to give birth any day and who is just hearing about this for the first time, plans to breastfeed, has never had a child, and needs to understand exactly what may be happening to her body in the next few weeks? What would be your guidance?
That's a really good question, and thank you for asking that. Those are the moms that really need the guidance, and we're here for it. First of all, don't or prioritize your exercise. And exercise doesn't have to look like I'm running on a treadmill or I'm running a mile. Walking is exercise. Gentle yoga is exercise. Lifting small weights is exercise. Build up for duration, not for amount, for intensity. If you haven't done any exercise, if you were not consistently exercising before. Secondly, everything will be overwhelming and you will not be able to prioritize taking care of yourself. And so it's very important that you need to lean into the resources that exist to support you. And that's why I love what Motherocity does, is because it distributes the work of taking care of the mom to a mom's network. And it takes away so much of the mental work that a mom has to do of taking care of herself and her baby. There are reminders. What should I be asking for? What should I be advocating for myself? What can my partner do to help? What can my family do to help? Those are all things that a new mom will have to manage, and nobody prepares us for it. And so I'm happy that there is an app that can help new moms with that, because you cannot outsource your exercise. That's the one thing that you cannot outsource, and your care for
Correct.
yourself.
Wow, thank you for that. Thank you so much. Thank you for mentioning Motherocity. Motherocity Health is the presenter of Maternal IQ for all of those who don't know, and we specialize in postpartum care and data tracking. What we prove to do and what we lean and yearn to do is to provide intervention services for mothers and parents who are navigating postpartum, especially where mental health is concerned. So thank you. Thank you for mentioning Motherocity. Thank you for the guide. Um, we would love to share more information and be able to touch those people who were not able to join us today. Can you give us ways to connect with you? And we'll share that on our platform as well. How can we keep in touch with you? How can we reach out? How can we follow your work in progress and your research?
You can always connect with me on LinkedIn, and please do. If we're not connected, let's be friends. We are all working towards the same goal here. Um, and you can always find my email at the University of San Diego website. I will share with everybody afterwards also a list of resources that came to mind, guidelines, how much exercise, when to do it, things to look out for if you're a professional mentoring women who are going through their pregnancy and that sort of thing.
I also would just like to mention that Nicole and I are friends. And we chat about a lot of these things collectively and share things and just kind of come together as a meeting of the minds. And she does exactly mean what she says. Reach out to her on LinkedIn. That's how we met. So if you ever thought that LinkedIn was not a dating app, it absolutely is, because I met Nicole and we've been dating for years.
That's right.
Professionally coming together uh, over maternal health care and how we can improve those things and work together to do so. So please, I do encourage you to reach out to her. We will list her information below, and we will also make introductions where necessary. If you'd like to use us for that warm introduction, please reach out to us, and we will be providing more information on the details that she's given so you can follow those guides and save them to your files and folders on social as well, to have them as a resource. Any last words?
I'm very grateful to all the advocates for mothers for doing the work that they're doing. And I'm grateful to Maternal IQ for shedding light on the fact that we need more help, more research in this field, um, because there are researchers ready to pick up the baton and start running and doing it.
Yes. Yes. I'm so proud of you and the work that you're doing. I think that it's phenomenal. I think that oftentimes some of the bigger issues get all of the spotlight when the smaller issues are just like the saying, it's the sum of the bigger problem. And what you've shared today is not only going to change the trajectory of how some of the moms who hear this and hear about it and gain insights as a result of it navigate through postpartum. But I believe that what you've shared today is going to effectively change the way that we are caring for postpartum moms in clinic as well as in the community. So thank you for everything you've provided. We would love to have you back. Thanks for being my co-host today on Maternal IQ,
Thank
where
you.
we've brought you less noise and more facts on maternal health care as promised. Thank you for tuning in. Have a good day.
Bye bye.
Bye bye.